and thank you, all of you. I think we had a really good morning, getting to know each other and talking about some really important things. And we have 3 students who are going to, we've given them a big task. They're going to try to summarize all of the themes that were discussed this morning in the breakout session. So Kate Benson from the School of Public Health and Health Professions is going to go first, and she's going to talk about what happened in the scenario groups. And then Donnell Gibson from the School of Law is going to talk about what happened in Photovoice. And Zaima Robinson from the School of Public Health and Health Professions is going to talk about the asset mapping discussion. So Kate, do you want to come on up and spend about 10 minutes talking about what you observed happening in the groups? Thank you.
Hi, I'm Kate Benson. I'm so good to be here today. Thank you all for coming. There were some really great discussions that I saw in the scenarios. The first was about housing. So the scenario dealt with a family. A family, the primary caregiver was holding down 2 jobs with inconsistent income and facing eviction. So the themes that the group came up with were primarily resource access, neighborhood safety, and then they discussed a lot about family dynamics. So who was providing care in the family, what were the appropriate responsibilities of the caregiver to make sure that no one was too overburdened, students trying to keep up with their classwork, and then manage family responsibilities at home, and then who needed to be cared for. So the things that they thought needed to be addressed were better job access, better transportation, and then they discussed a lot about the importance of social support resources. So support from faith communities and community centers addressing these specific needs. The second group addressed health and healthcare. So a mother with little access to healthy food who knew that she needed to improve her diet and her children's diet, but really didn't have the means to do that. So again, resources, the actual access to healthy fruits and vegetables, improving the collaboration, so learning about what people in the community want to see in their stores, and then marketing the availability of these to community members, matching the food offerings to the preferences and the knowledge of the community, and doing this through social collaboration with increased community involvement was really important. This group also discussed the importance of voting and policy change, so supporting the elected officials who are going to promote change that the community needs and wants. I thought it was really interesting that they brought up the effects of operating in survival mode. So when someone may have that education or the background, it kind of all goes out the window if you don't have the resources to meet your immediate needs and you're forced to make these urgent short-term decisions. We also talked about the importance of meeting people where they're at and promoting small adaptations in your goal of promoting healthy behavior rather than sweeping change. Someone gave an example of how they use healthy variations on ramen noodles instead of asking someone to suddenly start eating quinoa. Which I would appreciate. The third group discussed personal security. So they talked about a teenager who had a lot of responsibilities at home and was also trying to keep up with his studies, a high schooler, and was facing harassment from bad influences in the community and also from police. So this group talked about a formal avenue for community oversight of police rather than just expecting different community members to handle that. There needs to be kind of a more concrete way to go about that. They also talked about the importance of teacher training and how a general education needs to set students up for better futures through understanding the circumstances that they're dealing with outside of the classroom. They talked about providing family resources to reduce the burden on students, which touched back on another theme from another group, and investing in diverse police leadership and educators, greater access to school and teacher training that are going to identify more with their students through racial concordance or just on better understanding of outside factors. And then they talked about block clubs and the investment in community engagement and how important that bottom-up kind of resources are. So the fourth group talked about teen pregnancies. So two high schoolers, a high school couple, being pressured to end or postpone their education to support their new family. This group talked about health access, so access to birth control, and then from the point that this family was at, reproductive health, the need for a doula and kind of a comprehensive maternal health support, and how the role of a health home or a health navigator can be really important in that. Also the importance of insurance access for someone in this situation to ensure better maternal and child health. They talked about how this family is going to struggle in their situation to address their basic needs and how there needs to be a greater availability in the community of good quality housing, how they're going to balance the expenses and their needs regarding diapers, childcare, transportation, general things like that. They talked a lot about education and how these young people can be expected to value their education and meet their immediate needs, how that's also a balance, and the importance of educators of color who are going to value their students of color and understand their lives, and the importance of that consistency. The fifth group discussed a young man who was struggling to balance school loans and his incoming bills. He has had his electricity shut off and he can't get his transcripts from the school to get a job because of the outstanding loans. Here again, resources was the most important theme, and making sure that he knew the resources that were available to him through 211 and 311, navigating the system being a great challenge that he's going to face, and encountering resources who may or may not go out of their way to get him what he needs. They wanted to ensure that the resources that are available are properly organized. And this group also discussed the role of women leadership in the community and wanted to point out how many women are here today and how that's fantastic, but we also need to get the men in the community engaged in the conversation. And that comes to the kind of cross-cutting conclusions. So resources was the main theme for almost all of the groups. And I think that in summary, the groups pointed out that we have a lot of great resources available in the community that a lot of you are representing. So we need to increase people's awareness of those resources and access to them. We need to design resources that minimize people's barriers. So somebody brought up the example of Uber. People think of this as a good access for transportation, but it requires money, and not just money, but a bank account and a credit card and advanced technology that a lot of people aren't going to access. And then the need to organize and coordinate the resources to fulfill specific needs without gaps or overlaps, and how the resources should have well-defined roles to reduce overburdening of particular resources. Most importantly, the resources should be multifactorial and community-based. We don't need these top-down approaches that have kind of been the way that change is made for a long time. We want to increase the representation and sustainability of community improvements by building them up from the ground in each neighborhood or community by the community members themselves to address their own needs.
Thank you. That was really wonderful. Clearly, we're already seeing that there's a very deep understanding of the social determinants, the factors that influence the way people live and work and play. So Donnell, you're going to give us our next chapter.
Good afternoon, everyone. My name is Donnell Gibson, Jr. I am a third-year law student here at UB. So I graduated in a couple weeks, which I'm very happy. I thought that, so what I'm up here to talk about is the Photovoice Activity. So essentially what that involved is five groups who looked at a variety of photos, random photographs taken from the east and west side of Buffalo. They looked at about 6 to 8 photos and just kind of identified those that really resonated with them for one reason or another, and then they came back within their groups and discussed the photos and kind of what they meant and what they said to them. So there were, after speaking with the facilitators, I was able to also walk around and kind of hear the discussions that were taking place in some of the groups. And there seemed to be a few overarching themes of the photographs. So the first one that I'm going to speak about is, so I learned this word today, epigenetics. So I'm sure most of you are familiar with that term, but for those of you who aren't, like myself, it means how the environment influences gene expression. So really one of the themes that came out of some of the groups was how epigenetics interplays with stress amongst the Black community. And one subtopic beneath that was gentrification. So some of the groups talked about how many African Americans of low income are forced out of their homes for more wealthy residents. And some groups even spoke about right here in the Fruit Belt as being the prime example here in Buffalo. Another phrase or term that kind of came out of the discussion was a soul desert. So essentially what I think the woman was speaking about was how many people, especially of African American descent, of low income, how there are so many other problems that you may be facing going on in your life, and you have tunnel vision to address those issues, and you may or may not put your health into that equation. And actually, one of the groups also spoke about Maslow's hierarchy of needs, and just kind of talking about people are going to put their physiological and safety needs before anything else, and unfortunately, they put it before they're taking care of their health as well. So another subtopic from that is access. So access was defined very broadly amongst the group that really spoke about that. So access in terms of care, access in terms of services, transportation, and information, which I thought was a huge point that may or may not get discussed in the Black community, as far as like just receiving information, knowing where to go, where to get things from. A lot of times that's lacking in our communities. So as a part of that, Buffalo is not the most public transportation friendly city in the country. So just for people trying to get to the various places that they may need to go, whether it be a medical provider or a grocery store where they can get healthy foods. Many people in the African American community just don't have those resources. And what that often results in is a food desert. So a few of the pictures that were circulated amongst the groups involved a corner store. And being from Buffalo, I know you can drive around the east side and even the west side, and you won't go 5 blocks without seeing the corner store, right? So, but unfortunately, they up the price on a lot of the foods that they do sell, and then they don't have the best or the freshest produce and things of that nature. But unfortunately, that's the only resource for many people in our communities in terms of getting food. So that kind of led to one group talking about that situation kind of making people feel as though they're in a rabbit hole. So they're trying to do better for themselves. They're trying to get out the rut that they're stuck in. But for example, like public assistance, right? So if someone is doing a little bit better than what the government guidelines require, you're almost penalized, so to speak, because you're going to have benefits taken away from you or reduced. And really what you're trying to do is just better your life for your family so that you're not dependent on those same services and forms of assistance that got you through to where you are. Another theme that came up in many of the groups was mental health. And I thought it was very interesting that was raised just by looking at some of the photographs that were contained in some of the group's packets. But I think one of the key takeaways that many of you talked about in these groups in terms of mental health is that oftentimes African Americans don't see medical providers when it comes to addressing their mental health. And it is great that we oftentimes turn to the church, but the church, as noted by one of the participants, you might go to your pastor, but your pastor is not a medical provider, right? And they can't provide you with the same resources, the same care that you need, to be frank. So I know one of the discussions talked about it would help tremendously if there were more medical providers who were of color. I think that the person was basically saying that would help, for one, dispel some of the myth that surrounds mental health, particularly in the Black community, but it will also help patients feel more comfortable disclosing things that are really, troubling their mental well-being. Okay, we got the Community Health Center of Buffalo, so people knows. So, and then one of the final overarching themes that came from the Photovoice discussion was it's kind of twofold. So, lack of community support and policing. So I'll start with lack of community support. And one of the participants raised the fact that, community, right? Like, it's supposed to involve everyone. It's supposed to be a joint effort that everyone is contributing to solving the problem, but oftentimes it doesn't happen that way. And there was a photo in the packet for one of the groups where there was a Black woman who was at what appeared to be a rally, and she had her fist up, and you can see the strength in that, and the strength and the power in having her fist up, but you can also see the trepidation in her face, right? Like, she looked like, she didn't know whether or not there was hope in really what she was trying to advocate for. And one of the women in the groups took note of that and started speaking about that. And she really raised the question about, this shows strength, but what are we going to do after this, right? Like, we have these discussions, we have these conversations, these events, but oftentimes there is very little follow-up to actually correct the problem. And then also, just so the policing, there was a photograph of a police car, which, to me, I'm from Buffalo, looked like it was in the Kim Bailey area, like the Kinston Village, not the Kinston Village, but over by Langfield. Yeah, right. So there was a photograph there, and many of the participants just, kind of talked about the over-policing of the Black and brown communities and how that really has an impact on not only people's, like physical health, but their mental health as well. There was actually one woman, I hope she don't mind, shared a story about how she has a son who is attending college right now in the South, and her son is really excited, really wanted her to buy him a car, and she said, okay, I will, but I'm going to keep it in my name so that, should the police be behind you or something like that and were to run the plates, it'll come back to her and not to him. And I think that, that really resonated with me. It's crazy that we have to even have those conversations. And a few of the women, African American mothers spoke about how they don't even know what to tell their sons right now, just because of the way society is. And it's from a legal perspective, it's interesting to see how these sort of problems have an impact on someone's physical and mental health. So hopefully, my recap of the exercise kind of, sparked some thoughts in everyone's head. And thank you for allowing me to speak.
you so much. That was inspiring. Hopefully we're inspired to roll up our sleeves this afternoon and get to work on coming together, sharing our strengths, and thinking about the solutions. So Zaima, we're really excited to have you finish us off.
Thank you for having me as well. My name is Zaima Robinson. I'm currently a student at UB pursuing a master's degree in public health, and this June I intend on applying to medical school. So the group that I worked with was the mapping group, and we discussed a few different topics, and the most common themes were the structural liabilities within the communities, gentrification, and then the issues with transportation. So I've tried to speak about these things in tune, and just bear with me. So with respect to transportation, so again, as Donnell said, Buffalo is not a transportation-friendly city, which really has a negative impact on your access to available fresh groceries and even healthcare, creating what I'm going to call healthcare deserts. So within Buffalo, now it's getting better, but historically, there have been not enough healthcare facilities within the cities, and inaccessibility to quality care, which has led to poor access and even poorer outcomes in these communities. A lot of people not having primary care available within their community, having to either travel outside of the boundaries of Buffalo or even overutilize emergency services, which is a different conversation. But all of this draws into the point that lack of primary care services really reduces your chance of having access to preventative services and catching on to certain chronic diseases that affect these communities and are, contributing to higher mortalities and even higher morbidity among community residents. So that was one of the issues. In addition to the transportation issue, access to grocery stores such as Wegmans or even Tops further out, because certain Tops grocery stores will have better quality choices or even just a variety of different things. So just this issue with food deserts. So you have convenience stores within the city, and they have tried to make produce and fruits and vegetables available, but they're not of good quality. I myself yesterday was in one, and as I was waiting for my sandwich, I looked at the bananas and they were brown. And I was just like, wow, I'm in a food desert right now as we speak. So this is an ongoing issue and something that definitely needs to be worked towards. In addition to this transportation issue, a lot of these grocery stores that will offer better selections are not on the direct line of a bus route. So you can't necessarily just jump on a bus. And as we all could imagine, using a bus to get groceries is not the most ideal situation. So then this draws into the issue with having to pay for transportation, which may negatively impact your grocery budget. The next topic was structural liabilities. So within the city of Buffalo, there are a lot of vacant lots and even buildings that could be used for healthcare facilities to provide healthcare education that will allow community members to take better care of themselves. But these liabilities now are not currently being used, and the reason why they're considered liabilities is because they're driving the property value down in these surrounding areas, and poor property value leads to poor management of these areas. So, the surrounding areas are not adequate for the residents with respect to just daily walking to prevent things like obesity and things of that nature. So the issue was that Buffalo is somewhat structurally designed to maintain this isolation with respect to the highways in the 33, how it cuts right into the city, and a lot of the traffic is contributing to pollution and things of that nature. In addition to these structural liabilities, now we're going into this issue with gentrification. So a lot of areas within the city are being revamped, but it's not necessarily for the benefit of current residents, it's for the benefit to draw others into the city. So you're driving the prices up for the current residents, forcing them to move out into now suburban areas. And this may sound good that they'll be in suburban areas, but now the problem is you're just moving them. So you're relocating the issue and not necessarily addressing issues within these communities. So this is an ongoing issue. One specifically, the Fruitvale neighborhood, more specifically, the McCarley Gardens. So this area is being redeveloped, but the residents are being pushed out to accommodate these, redevelopment approaches, if you will, for the benefit of others and not community members. So what needs to be done is, again, having representation, bringing in policymakers who can be a part of this discussion and have enough impact to make changes that are needed to improve these communities and the issues that have been affecting these communities for a very long time. So these are the solutions going forward. Bringing these individuals who have the ability to make decisions to the table and incorporating them in discussions and pushing to have change occur.
Maybe one more round of applause for our student stars. Fabulous. Thank you.
That really just gives you a sense of hope and future when you see young people who are participating at this level. I want to thank our speakers from our volunteered facilitating and note-taker group. They're all members of the University of Buffalo, and they have done a stellar job so far, and we expect that they will do the same again. Let's give them all the very best to all of you going further in your education. We trust that you will do well, and both your education